The WASH4Health Project seeks to use the improvement in the hygiene, water and sanitation conditions in the communities to improve health.
WASH4Health was designed to follow 6 components.
Water, sanitation being the main one, SBC, social behavior change, PPP, which is public-private partnerships, governance, and the last one was public institutions.
So the first component is to improve usage of household latrines. And then we did it through CLTS, that community-led total sanitation.
At first, we didn't have latrines. So when they came, we drawn the map of the community. So you can see these houses. There was no latrines. So this is a phases. So all the community houses were full of phases.
By then, we realized that no, we were defecating around. Then they advised us what to do. And then we moved to what? Dig and bury. By then, there were no latrines.
Time toilet you call toilet in bush. Say so to say the bet me according to me. And a bit so you call now walk a cow be.
Jana na public one. Nani padudwana na kosu. Nesa no munye bia obetra no a monitor nti oba connect say so aye basantu ni bu ofie dia nse say bia munye bia.
Because of the open defecation, there were a lot of cholera and typhoid in the system when we do the screening for food vendors. The cholera and typhoid was a bit high during those days.
The records at the time did indicate that only 1 out of 5 households in Ghana had access to an improved latrine. Almost 22% of the population were practicing open defecation.
The communities were quite dirty. People were practicing open defecation, no practice of hand washing in most of the communities.
Most of the partners were putting so much pressure on the community people to find a way of building their own toilets. And year after year, these toilets will collapse and they will come back to build. So you were counting and discounting along the line. So the issue of access was not sustainable.
Then when global community came into the district, we implemented WASH, which is a household latrine construction. And the people bought into the idea, where more than 85% of the households have and use household latrines. And they also tidy up their environment with hand washing facilities.
We developed what we call the Dignilu. The Dignilu is a plastic latrine that comes with some innovations to target the poor on each community.
We've helped households to construct their own toilet facilities, which have helped about 50 communities in Adan West District to attain ODF status.
Triple to USA. Triple to USA. Triple to USA.
Thank you.
When they came in, they taught us how to do cleaning and then how to maintain our animals so that they will not be fizzing all over the compound.
Afi na agbeti vavala mi fle azizan pli e amo de jodi afojila no de vola kemi ko tola agbeti doma kemi close pli mi ko boany bayene belam me mavalo sanitation mi mavala no agbawo kakara fiema mi danu mi ko no mi cho no beji o mi okafu wonu anyi akene sievala mo ko be ni mi na nda mi na si klon checheche afi adano. And what I follow no la mi kunya kon ko bunduru obeji.
And for the first time in the history of Northeast, we have 2 communities that are sanitized, which is the highest level in the CLTS spectrum.
Realize that whatever they are going to do here is going to benefit they themselves. They were attending their regular meetings together. Any meeting they call, to see the whole community will come. Then they were also following the action plans they have for themselves. Regular cleanup exercise, coming together to dig their piece, supporting in the construction of the latrines, and all the things they put on the plan, they were able to follow the plan religiously.
We have worked to improve the sanitation conditions in over 400 communities in the northern zone alone. And we have over 330 communities that have been supported to attain the open defecation status. That is, open defecation has stopped in those communities, and the hygiene and sanitation conditions have also improved in those communities.
We have more than 4,000 Dignilus installed across the country, which is a great achievement if we look forward to achieving the SDGs by 2030.
The second component is the improved water supply for communities.
Drilling boreholes, we have rehabilitating boreholes, and more importantly, we have been constructing small water systems which can benefit from 3,000 to 8,000 people.
Ya tana burin buna nana ngai inka nyanyin buin inka charon kwa inka tululu mwa.
The water that they give us is nice, but if you are drinking it, you will feel comfortable.
Uchomuko baby ya fra baby Togo line no a. Oho ball hole ba ku was area ho. Na ball hole ba ku wo na bu ya fra ho so na bu kwan so. O ma combine ade no na o mo di reservoir no akosi tinjasi krom na o ma ma stand pipes wo krom na o ma twitwi bi ama amanfo ofie wo a open den that's sia na ya twa ama ofie.
We're looking at the distances where the women travel to go and search for water. Where sometimes they have to go to the stream and search for water, or travel to Dankwakwa, which is about 8 kilometers away from here.
It was really very difficult to come by water. We're dependent on water from the streams, rocks, and others.
Say amudi bia ben ye no. Ye shada mbere santi ye nso no tambi aye pe. Yetimi nya nso no say kwa entwa aye no. Yetimi de ye aduane, yetimi de twale, yetimi de ye bibia.
Communities that are less than 1,000, we drill boreholes for them. Some of them had access to potable water for the first time. And then the small town, we have done about 5 of them under the project. And first time we have brought in innovation where the main power source is the solar. And then we are using the grid as backup.
We have been extending and linkaging multiple communities. In some cases extending to institutional places like the police, like schools, health clinics.
In the area of governance, we have helped to strengthen the capacity of the staff of the MMDAs that we are working in, particularly environmental health units of the MMDAs, the capacity of SHEP coordinators, even at the school level, what we call the school-based health coordinators, to help them to understand the work in the area that they are doing and also to acquire new skills.
Despite the efforts that full staff make in ensuring that people have toilets, there's always a group of people who, even if you give them 10 years, they will never be able to afford their own toilets. And these are the people we refer to as the poor and the vulnerable.
The SDG asks the implementing partners to ensure that no one is left behind. But if you go to a community and there are people who cannot afford, it means that they are going to be left behind if there is nothing to take care of them.
Our pro-poor intervention is basically in the sanitation sector, where some poor and vulnerable individuals have been identified and supported with one of our innovations, that is the Dignilu.
Nangun tumala baham panawa kawatu kuma mena sagalan fia mbale garamo pu ala maltal pu wena ko elibi apahe bela yan sontone mena pahe ya
ramnya kile iwamewa yaga bene inga kikon ki ya chwa monema sunsun opio mi nonna mi loko nyeni sun sena ba peno amele e pe inga fun
trafi nole nye uke bahawo e hane wakunya hiyo epi anunyami kino fono tegeke lo ake trafi no anekuye e jibwajo wawe pio no kusenga.
Loteiri happens to be the first community in the district to be declared ODF within a shorter period of time, like about 6 months.
Before then, you could find household latrines only 2 communities, and these were basically Sola and then Kalba. But when the partnership started and grew out the program, within the first 6 months, we had entered about all the 300 communities. About 290 communities have become ODF from the 330.
The behavior change component of the project is looking at the essential wash and hygiene behaviors that cuts across all the project's major areas in terms of water, sanitation, and hygiene. And these are done through the use of the behavior change communication package that was developed by the Manov Group for this project.
The booklet has components of them to teach school children how to wash their hands, to teach families how to take care of their latrines and their surroundings, to teach healthcare professionals or healthcare practitioners how to make sure they practice their IPC.
You play. If you get this, you start. So if you play another, you get maybe like 4. You count. If you lie on a black place, they'll give you a paper to answer a question. So if you get it correct, they'll promote you.
The game is very interesting, and what we learn from it is to keep ourselves clean and the environment clean.
It tells you what open defecation is, how to clean toilets. You can find it in a picture. The way a good environment should be, it has been stated in the picture.
From what we are seeing, we can see that this is something that will have lasting impact, because when you catch young people like the school children at early age, and people, oh, these behaviors, we don't even know that they exist. But right before us, see, they are easy and simple things that we were doing, but we never realize that they are either good behaviors or they are bad behaviors. But with the game, it helps to let people really identify these behaviors easily and translate them as themselves.
I can hygiene, sanitation,
when we did the media project review, we realized that behavior change in terms of the adoption to safe drinking water changed from 26 to 29% over a period of 9 months within the project, which we think is a very good impact as far as the project is concerned.
So we have also been working extensively in schools with menstrual hygiene management.
For menstrual hygiene management, we're working closely with Ghana Education Service in basic schools across, again, our project regions.
Some of the ladies, they don't have money to go and buy pad. They will use cloth.
When you have your menses, you cannot come to school. We are in the rural area. So for my girls, when they are in their menstruation period or time, at times they find it difficult to come to school just because they will not get the necessary materials to do or to help themselves.
One of the key innovations is the supply of reusable menstrual hygiene materials, which we get from a partner called Big L. They are reusable panties, and I must say they are first in the country, which comes with special towels as well. These materials or panties can last as long as 2 years if the girls are able to use them very well. So which means that they don't need to procure or buy menstrual pads every now and then to use. They are very hygienic and then very easy to use as well.
Just open it gently. Let me see your big girl panties. Is it beautiful? Girls, do we like it? Okay, so let's say big girl panty. And I said it's used for what? Only when we are. Okay.
We need to bring it to the Ghana Standards Authority and Food Drugs Authority for them to give us the necessary approval for us to produce on scale to be able to get to the corners of this country, because there are a lot of vulnerable girls who, even as a result of not having menstrual materials, even drop out of school, and that's not the best.
We also support them with a simple tool called the Smart Cycle, which we teach them to use to calculate their menstrual cycle.
They have printed some of our menstrual hygiene materials even for the schools to use. And so it also supports the education on menstrual hygiene.
For us, it's very important to break some of these stigmas that have been affecting girls and preventing them from attending school. We have not only worked and trained girls, but also the boys, who have a lot to do with that, and the parents as well.
Through the PPP, we've been working with the Unilever Foundation, we've worked with Goldfields Foundation, we've worked with Tuton, and then through that, we worked with Duraplast to develop a plastic latrine to help us to improve access to latrines in the communities.
Nsuo deɛ obi na etubula bi na yɛtwe bi kakaka.
Emu hɔ hɔ na eyi ma kompiri bɛyɛ nsuo ma yɛ. In fact, na enye. Nsuo no kɔyɛ bibi te sɛ hɔ elephant a yɛnya nsuo.
Yɛbrɛ anse yɛnya nsuo no.
Subri is a particular or a peculiar community with water and sanitation issues. So we thought it wise that once we're going to do this project as a pilot, we start with the community with peculiar issues to see whether that project is going to be viable so that in future we can roll it over to other communities.
And the Asian Global Committee abomba maybe no engineer na ba me na adwuma hu adwuma mo ye no hu se global committee on ba bre o ma na de papa
ababua ye pa we na mo ye no ye na ye ben we betumi atwe bi akọ ye fie
a similar process now the betutu no na ye den ewom what you say me pese hu se the pronya ne te we pronya body e ba betua pronya body so na we release it. Ochina you will sit at the site.
Mama chin so mama say yakon abetini ye. See ya first one, second one. Just say nyame adwane speaking so be third one. The team no ama ya hu adwuma nani so. Ama ya nya bi kura ono se nsuo mu tochima ya yi nipa ono no beye. Ya yi o ama me nipa ono so na be hwe wansan dwumadie no so ama yen.
We normally want to see to the sustainability of such boreholes. So what we're doing basically here is that to train, personnel from the various communities to make sure that after we exit, they can at least manage their own water systems by themselves. Yeah, so it's more like a technical training we're giving to them to man the various boreholes that we drill.
Go Fields Ghana, through the foundation, has partnered a lot of agencies and key stakeholders in trying to bring water and sanitation to the doorsteps of our host communities. Yeah, so, and then with global community having the vast experience in this area, we thought it wise to partner them in establishing our purpose.
The final component is the component 6, which entreats us to provide WASH infrastructure for schools and then the healthcare facility.
Most of the schools were not having toilets, so they were doing open defecation.
We used to go around the surrounding bush to just do it openly.
People used to attend nature's call at home, and the worst thing is that when they go home, they don't come back.
We had only one toilet for use in the whole school. That is both primary and JHS.
Most of the schools don't have water on the compound. So as a result, most of them were having problems with health.
By the help of USAID and then global communities, we have had 2 toilets, each room containing 5 and then 4 rooms as well, 4 for boys and then 5 rooms for girls.
That is a modern toilet that even has a changing room for the girls. They continue by giving us water in the school. That is a borehole.
With this facility, we have urinaries there where we can go and free ourselves if we feel like urinating. We also have a poly tank that has been provided with taps where we wash our hands. And in the girls' changing room, there is a tap there where they wash themselves up and also clean themselves and come out. They have also provided us with Veronica buckets for us to help in the hand washing activity.
When we are from the toilet, we wash our hands.
When you pour the soap into your hands, you rub, then your fingers, you rub it into your palm. In between your hands, you wash it with under running water. And then you wash your hands, at the back of your hands, you wash it, and then you clean it with tissue.
We have talked about personal hygiene. We have looked at how to wash hands, the proper way of washing the hands.
It has reduced the human contact with excreta, and the 2, it has reduced poor hygiene management. Most of the children now, when you go to the schools, they realize that after defecating, they need to wash their hands. Before they eat, they wash their hands. Most of the time, when they come out from the classroom and they want to go back to the classroom, they wash their hands with soap under running water.
We have 5 schools. That's Adiamra, we have Ntenteso, Domia Bra, we have Kasikrum. They all now have a proper and a good toilet. So the environment is now clean.
We provided 7 institutional toilets for 7 schools in the Adan West district, and then 8 institutional facility in the Adan East district. And then we selected about 60 communities which we implemented CLTS activities there.
Our cleaner used to go far distance to fetch water, provide for our daily basis. But as the water has been provided here, now it's easy to get water, and which is also hygienic.
We have provided close about 25 institutional toilet facilities to many of health facilities and then the educational institutions.
Particularly in the Solatuna-Kalba district and the Bole district.
We have been working on cholera prevention as well since 2014, 2015, when we saw the last large outbreak of cholera. Since then, we have been working in hotspots.
So we started the quarterly disinfection exercises in Cape Coast, and I could say that it was very successful.
There were a lot of also COVID mitigation interventions.
What we did was to really intensify playing of a lot of hand-washing jingles on radio stations.
The people working on the healthcare facilities are trained in the various forms that they have segregated water for drinking, water for cleaning, for disinfection, making sure that the waste is being treated properly.
In the slum and the bigger cities of Kumasi and Accra, where environmental health officers supported along, the capacity that was given to them through this project helped them to even continue burying the dead.
We also supported most of the institutions, especially the markets, very public places in communities where we work. We supported them with hand washing facilities.
Last year in this community, following the opening of the Bagre Dam, the whole community was flooded.
The first thing Global Communities did was to carry out an assessment.
So after the assessment, they came with the support of the Municipal Assembly to disinfect this community to prevent outbreak of cholera.
We realized that houses collapsed, farmlands were washed away, the roads were blocked because they were flooded and communities were cut away. The boreholes we provided in some of the communities were submerged. Some latrines also collapsed.
So the first thing we did was to send aquataps, and aquatap is water purification tablet that purifies water. So once we're able to send that to the community and for the household to use it, you are rest assured that they would have potable water to consume within these very challenging times, and that will save lives.
This will help to make the water wholesome and safe for drinking, and to improve their health, so that it will also help to prevent future water and sanitation related diseases like cholera, etc.
Again, we also build the capacity of the environmental health officers and the NADMO officers how to use the water treatment or water purification tablet, that's the aquatap, before they went ahead to distribute it to the communities.
There are still many places, many regions and districts, communities that don't have access to water or proper sanitation, and we need to pay attention to those districts, regions and communities to make sure that they have access and they have a dignified sanitation.